Hello. So for this week, I chose to do um, this encounter with a patient. This is one of my patients who has a history of opioid use disorder, and they were recently diagnosed with major depressive disorder. The patient expressed that he has some frequent sadness, and the patient also stated that this was primarily due to some financial stresses that they were having. So most of the stress that they had were due to financial issues. During the session, we did use cognitive behavioral therapy, and this helped the patient to recognize some of their negative thought patterns, and it also helped them to relate this to their financial situation and their feelings of hopelessness, because that's one of the main characteristics this patient stated that they experience is always feeling like they had no hope. The primary goal of the therapy was to challenge their thoughts and develop more adaptive coping mechanisms versus feeling hopeless and feeling sad, feeling depressed. When discussing motivational interviewing, this could have been particularly beneficial for this patient in a couple of ways. I think, especially because of the history of their opioid use, the drug abuse. And the motivational interviewing could have helped them to explore some of the uncertainties that they have towards seeking help or making decisions regarding their issues with drug use. Like addressing it with stress, because that's one of the biggest things they did. Instead of them using positive ways of getting better when using the drugs, they decided that they would deal with it using the substances when they were dealing with stress. By using the motivational interviewing, also it could be better for the patient when it comes to support. The patient feeling more motivated to improve their mental health and their overall situation, because the motivational interviewing could help guide them to express their own reasons for change rather than feeling pressured or judged. So I think it would help in those ways. My comfort level is increasing, I feel. I think it's steadily growing a little bit, depending on who the patient is, what the diagnosis is, and exactly what the motivational interviewing is about, and the topic, and the issues the patient is facing. And I think it's going to continue to grow. I know it's going to continue to grow as I develop with my skills. And I do plan to incorporate motivational interviewing regularly when I do one day have my own clinical practice, because I feel like it's very important in clinical practice, by using it during patient assessments and when discussing their behavior changes, particularly with the patients who are unsure about treatments or some life changes. It's focused on collaboration and patient empowerment fits well with my approach to care as well. Because with motivational interviewing, I believe it will enhance patient outcomes, and it'll help encourage more engagement and self efficiency. I feel like the patient can definitely become better if they have that motivational interviewing as part of their treatment plan. And that's about it. Thank you.